Our next speaker that I'll welcome to the stage is Wendy Ah Chin, the Executive Director of the Office of Aboriginal Health Policy and Engagement, NT Government. Welcome, Wendy.
Thank you. Thanks, Brian. Good afternoon, everyone. I apologise for having to be here at the end of the day when I'm sure you all want to be off doing other things and perhaps getting ready for dinner tonight. Before I begin, I'd like to acknowledge the traditional owners of the country we're on today too, the Aranda people. This is a presentation I've given before at various forums, but I'll just quickly go through it today, and I'm sure much of what I'm going to talk about over the next 10 minutes or 9.5 minutes you've probably already heard, so I'll just try and be brief. Again, just talking on what Aaron and Sharon talked about, we do know the numbers are declining. I was late, apologies for that this morning, because we had a huge thunder and electrical storm this morning in Darwin. None of the planes could leave the ground because they couldn't fuel up. But I understand the Minister gave a very passionate speech, and that is about just really renewing our commitment and leadership to this and developing really good partnerships with AMSANT and other partners about really wanting to build the workforce, particularly around AHPs. I think it's really important, and we all know how it's important and essential to make sure we get more of our Aboriginal people employed in our clinics. I won't spend any time on this slide, just to say that the Minister has announced it. The work we've done to date really has just been around developing an implementation plan focusing on 8 key priority areas of action. The approach we're taking pretty much is about being very pragmatic, looking at what are the absolute key areas we need to be focusing on and making sure that over time we're getting an incremental but also a sustained approach. Again, this really just goes over the importance of being able to have more of our guys employed in the health centres, but also as we've gone around to the communities and talked with many of you, we've found that, yes, people are acknowledging the importance of getting more AHPs, but also about getting more Aboriginal people employed across the whole health and hospital sectors as well. So we want to take that on board and see how we can encourage more of our guys across the whole health workforce. And only last night I was talking to a colleague of mine, Dr Christine Connors, and interestingly there, for those of you that may not be aware, the data coming out now that we're reporting against the target areas in COAG show quite interestingly that NT as a jurisdiction is the only jurisdiction that it's on track to close the gap on the life expectancy between Aboriginal and non-Aboriginal people. So we're the only jurisdiction in the whole of Australia that's on track. Which in itself is good, but the data sitting behind that, in the sense that Christine Connors has, is that we're already showing with that data that we're starting to slow. The assumption at the moment, and we'll test that over the next few years, is because pretty much health has pretty much done all that health can do in being able to address that target. The rest, very importantly, relies on our partners in education, in employment and in housing. So for us to improve health, it can't just be health alone. We have to address overcrowding in our houses. We have to get more of our young ones through our schools that can read and write, and we have to be able to get jobs. So this is not just a health issue. We need to very much have that broader whole-of-government social determinant approach if we're going to make a really sustained change over time. So this is just priority 1 of the 8, as I mentioned. The first bit of work we've been looking at is developing a model of care that will assist and support our AHPs to be the leading primary health care agent in a number of settings, and that will include the hospital settings as well. The Minister has talked before today about the fact that when she worked in Alice Springs Hospital in here, they had a lot more Aboriginal health practitioners, so we're doing a lot of work at the moment with partners to make sure we can try and build those numbers back up. So really critical that we do try and have a model of care that can support the AHPs in the workforce. We've also undertaken a remote study tour, but that's just a fancy way of saying we've actually gone out to a lot of remote communities in the top end of the NT and down here in the centre to talk to you about what we can do to get more of our young ones, but also people that may have been AHPs in the past and may have led to try and see what we can do to encourage them to come back. It's early days yet. We're seeing a little bit of interest, but not a lot. So we really need to kind of crack open some of the work on that to see what can we really do to get some critical mass and help get more of our guys coming back into the profession. As a part of the Back on Track that the Minister announced back in June this year, we did a recruitment exercise in the NT, and again that showed very small numbers at the moment, and we still really need to test that. We need to test it to say, what is that telling us? Is it telling us that there's no one out there that's interested in these roles, or is it just that we're not engaging as effectively as we need to be? So this is going to be an ongoing iterative exercise where we need to keep on coming back out, engaging with the communities, asking what it is that we can do better, how we can work with the communities and how we can have the community support those wanting to come in as an AHP. Another bit of work that the department's done has been around looking at identifying the vacancies, and Braden, who's in the room today, led this piece of work where we really tried to understand and to determine what are the numbers. What are the numbers, at least in our Department of Health and the NT, what the numbers were again of the overall AHPs and how many were vacancies. Interestingly, as a part of that, we were also trying to, I don't know whether we quite got there, but we were also looking at what were the number of AHP positions that had historically been there but then had transferred over time to nursing positions, because, you know, we hear anecdotally a lot, people say, oh, well, I just couldn't fill the AHP, so I filled it with a nurse. So we're really trying to unravel that and say, no, let's not do that. Let's try and look at doing the hard yards. What is it we can do to make sure that we're recruiting more of the AHPs? Priority Action Area 3, the entry pathways. Again, we know, many of us will know the barriers and the obstacles in the room today. That's really around very limited opportunities to create more entry pathways for our guys to enter into this. And also with that has been around the barriers, particularly with the remoteness issues in terms of training and support. A number of key things there to mention. One, I don't think I'm stealing the Minister's limelight, she may have mentioned this morning, but for the very first time ever, that excites me but saddens me at the same time because it is the first time ever, we've actually established a scholarship program for people who are doing AHP training. So for the first time ever you can apply and successful applicants will actually have cash that they can do with what they like to help them to undertake their studies to successfully complete the AHP. It will be for people doing the Cert 4 only because it's about trying to attract them in. It won't include existing AHPs with the Cert 4 wanting to do a diploma. We're addressing that in separate ways to support that. So that's good, and we'll see that advertised, if not late this year, early next year, to try and get the first graduate intake with Bachelor. And I mentioned just before about the bit about really we need to get greater partnership with our partners in education particularly, but also in housing and employment. So a part of this early discussion for me at least as a part of the Back on Track has been around really needing to engage. We need to do away with myths that people think there's hordes of our guys just waiting around in corridors for jobs when we know on the other side of the fence we've got education where a lot of our guys aren't coming out that can read and write. A really big issue that we have to develop better partnerships if we're going to tackle this. The fourth key priority action area is around the career structure. Many of you will be aware that the department's kind of, come and gone. They've had a few takes at this and we haven't really done that particularly well. We've now got a division within the department leading that and has had a number of discussions with unions to really try and articulate what that is. There's a whole bunch of work behind that which is around making sure that we have sufficient resources and systems in place to support that. But the good news is we are well on the way of having a very, very decent attempt at getting that right, and we'll announce that as soon as we can sometime early in the new year. And our ongoing work with AMSANT really just about as a part of this particularly, but into the future, how can we work better in partnership? And I've had a number of conversations with some of you in the corridors today in AMSANT around how can we really build the collaborations we've got and work smarter together so that we're not all kind of doing the same thing twice. We haven't got duplication, but we can build on our collaboration. Okay, the next area is really just an internal one for the department, but I'm more than happy to discuss it in detail for those of you that may be interested. This is a key piece of work really around being able to embed and integrate our AHPs into the department. Unfortunately, up until now, we have what's called a capability and leadership framework. And what that does quite cleverly is articulate where your profession sits and then matches it against the particular competencies we have, which are recognised by the department to give you a level, if you like, and that's linked to your salary, your core set of values or behaviours and skills and attributes. The AHPs have never been in this. That's been a really big task that's never been undertaken, and we commenced that only a couple of months ago. But again, that'll be a really good piece of work. What it means is it actually standardises the AHP, and if you're an AHP in the Department of Health and you think you might want to get outside of that and work in another area, you can clearly see, without necessarily having an AHP hat on, that you can match against this skill and this other job and this other profession. So it does allow greater mobility that we don't have at the moment and have not had historically. And that's also something we're hearing from our AHPs, is while many of you are absolutely committed to it, want to stay there, AHPs are saying, what kind of management support can you give us to transition out to go work in other management or more senior fields? So that remains a really key part as we work through this. Key priority action area 6, again, is around leadership and development. So we are continuing to work with AHPs in terms of more rigorously developing a leadership framework to support them. We haven't really had any rigour there. It's been pretty much ad hoc or led by the individual saying, hey, you know, Wendy, I'd like to do some work around this. We're really trying to make sure that the approach we take is more systemic. And again, working with AMSANT to see about how we can better support and open up opportunities for leadership and development opportunities that we may be, leading in the department. And again, what has happened in the past has probably been more ad hoc rather than more of a strategic, focused approach. Priority action area 6 is around the RTOs, and again, this won't be new to any of you in the room, but it is about how can we work with other RTOs, including bachelor cards. What is it that we can do better? What I'm hearing, and I'm not AHP trained, I have to say I have a health science degree, but I'm not an AHP a trained person. I came back into the Department of Health 3 years ago and was quite dismayed about how the numbers were dropping. So I've kind of, as a part of my role, really taken leadership on this to do what I can in my role to try and build on these numbers. So forgive me for not being an AHP, but accept the fact that I'm very passionate and committed to this as well. I'll do all I can in the department to make sure we build that collaboration and the work. So this is around really just continuing that collaboration, talking with Bachelor. We've got regular and open communication now, talking through the problems as we identify them when we go out and talk to the communities. These are the issues, and really trying to develop and establish ways where we can do it. And I think an important part of that is having that regular loop. We have those discussions at a number of levels with Bachelor and with our other partners to say what it is that we can do better, and we're always open to meeting and talking with other people if you have suggestions. No such thing as a new idea, but we really need to build on the collaboration with this initiative. The other thing that came out of this, I think it was out of Catherine, was around the fact that when IT was used particularly well, it was done, where it was done well, it really provided a lot more one-on-one support for the AHPs. We didn't really see that replicated anywhere else outside of Catherine. So we want to really just look at what were the variables that helped make that such a success in Catherine, and what can we do to make sure that we can really communicate and promote that much more widely, because the biggest issue we have is really around remoteness and the access to training and being able to support AHPs while they're in the community and in the health clinics, but also when they're out of the training. While I think of it, something the Minister has said before today too was around the fact, what I'm trying not to do is make this a flogging opportunity for Bachelor. It's not about us blaming other people. One of the things we need to and should take ownership on is the fact that in our clinics our AHPs have not always been supported. So we are conscious we need to do work with our current clinicians around what their role is in supporting AHPs in the clinic and also their trainees. So it's a really big issue that we are trying to take some strides forward on. The last one, I'm pleased to say that in terms of the Back on Track initiative, money is not the barrier at the moment. We have been able to secure additional funding to actually support and drive this. So for me at the moment, money is not something that I'm saying, oh, well, if we just had more money, we could do this. We actually have the money. What we need is to build on that collaboration, to seek ideas and to help drive this together. As a part of that, the implementation plan is an annual implementation plan. We're meeting and reporting to this every month with the Minister, weekly actually with the Minister, and collating data from our top end and Central Australia Health Services monthly. The importance, I think, around this initiative is the fact that we are absolutely collecting the evidence base, we're collating the data and we're reporting on it. So we're being very much led by the evidence in terms of what that tells us. So it's not, the money isn't a problem. We have that, we just need to build on our collaboration. And I think that is me done. The last slide there is just around some of the KPIs. They speak for themselves in terms of how we'll be measuring this, but we'll also want to make sure we go out and engage with you and continue to have that dialogue. Thank you.